Hi, today I'm going to be discussing a lot of questions that I've had about Accutane. I was 14 when I started Accutane, and I turned 15 while I was on it. Around the beginning of 2017, I started going on Accutane, and I went on 40 milligrams for 6 months about. I made a video about it, kind of documenting my monthly progression. If you guys want to see, I'll link it below. First of all, I'm just going to explain what is Accutane. So Accutane is a pill, and it's a prescription medication. So you can't just go to the pharmacy and get it. You have to go to your dermatologist, and they have to prescribe it to you. You have to do a consultation, and then they'll like look at your skin type and then determine how many milligrams you'll go on. And so pretty much it's kind of a form of vitamin A. It's not exactly purely vitamin A, but it kind of overall decreases your oil production in your body. So if you have acne in your face or on your back or anywhere on your body, then it'll decrease the oil production and therefore decrease your acne. It's most commonly referred to as Accutane, but the general name is Isotretinoin. I use Clairvis, which is just like a different brand. Accutane is not an antibiotic. Antibiotics affect the flora in your gut, and that's a way different thing than what Accutane does. That's what my dermatologist told me. With antibiotics is that it could take way longer. For antibiotics like your acne, it could take from 12 months to years, and my dermatologist told me that it was just, there's a lot more annoying side effects that you have to deal with antibiotics, like more stomach and bowel based problems, and then like nausea and things like that. So I decided to opt for Accutane. Accutane does not fix scars or scarring. You'll have to do that with a laser treatment or something like that, but unfortunately it does not decrease scarring. But I did have a lot of hyperpigmentation, which is kind of like reddish spots, and it did decrease with the acne. I think it was just kind of like part of it. But as you can see now, I should probably show you my face. My face now is all right. I don't have nearly as much acne as I used to have. I just have hormonal acne, and it's really good, and I just have regular blackheads. Whoa, it's really close. And yeah, just hormonal stuff around the jawline and chin area, and my face is less oily than it used to be, so that's good. Why Accutane is so popular is because it really does work for a lot of people, and another reason it's kind of popular is because a lot of people think that it's really bad for you. There are also a lot of myths and kind of like fallacious reasoning with it, and it doesn't really make sense to me and a lot of doctors, I guess. But I will go over some of that. Why people are so hesitant to go on Accutane is because of all the side effects you can experience, and they are hardcore sometimes. So you can experience constipation, dryness. This one is huge. Dryness everywhere. Your lips, your eyes, your lips will be so chapped, and you can experience an Accutane rash on your arm. I went through that on my other video that I posted. Just overall, the sides of your nose will be dry, the inside of your nose will be dry, which can lead to really random nosebleeds that I had to wake up in the middle of the night for. And it's just overall really frustrating and kind of tedious, but I thought it was worth it. A lot of people don't think so. A lot of people claim that it messes up their liver. I talked to my dermatologist because I told him a lot of the questions that people had, and he said that there's not really any high evidence. And then I also have this from acne.org, and this was written by Belgium32. My derm has prescribed it daily for 4 years, she says, and she's not once seen elevated liver enzymes to a point where she would have had to cut treatment, and they have always gone down afterwards. So it does affect your liver in some way, and it does affect your body obviously, but not to an alarming point, I guess. So it could be different for people depending on the dosage and stuff, and everyone's different. But a lot of these, again, a lot of people like to put fear into people, and that really bugs me, because another thing that really bugs me is people tell me in my comments to just wash my face and drink a lot of water. Like, I've legitimately gotten a lot of comments like that, and I mean, I understand from their perspective that's what you need to do, that's what they need to do to get clear faces, but a lot of it is hormonal, genetic, and it depends on yourself and what you're made up of, you know, and what you're more prone to and all of your background and all that stuff. So it's not as easy as it seems. This is another thing I think is worth mentioning. Many people that decide to go on Accutane do get a lot of criticism. Some of it could be with a good intent, like, oh, you don't need to do this, or why do people care about their acne? Like, and it can come off as a little bit ignorant. For one thing, acne is painful. Acne is just not a good time. It's not a fun thing when it hurts to lay down sideways because your face is touching the pillow and it hurts, or when you have an itch on your face and it hurts to scratch it, or even when smiling hurts or talking you feel pain. It's not fun to just have these cysts on your face. It's not only about looks. Yes, people do it for looks, and that's okay. They can do whatever they want, but it's just, please try not to be so ignorant about it, because there are many reasons, and it's not that shallow sometimes. Sometimes it genuinely hurts and is uncomfortable. So I would recommend, though, I really need to put this out there, take Accutane as your last resort. If you have mild acne, I wouldn't recommend taking it. I believe that your dermatologist will very rarely put you on Accutane. Accutane is something that you put into your body, and something that affects your body pretty severely for a couple months, and most dermatologists won't prescribe you that. They'll prescribe you an alternative to Accutane, because it is something that you should really consider waiting till last minute, or till if you've been struggling for a really long time or have huge cysts and stuff like that, then yes. But I would just recommend talking to your dermatologist, because I can't answer, I'm not a doctor, I can't answer all the questions, even though I'd love to. But another side effect you can experience is joint pain, back pain, depressive thoughts, and if you get pregnant, you can get birth defects in your baby. So that's really the biggest one. They take a lot of precaution before you go into it. So after you're prescribed Accutane, you have to go pick it up every month. They give you a monthly dosage, I guess, monthly pack. Also, every month you have to go get a checkup. And in that checkup, they'll ask you any side effects that you've been feeling. I also forgot to mention that every month during my checkup, I took a mandatory pregnancy test just to see that I wasn't pregnant. You really won't see significant results until like 2 months in. A lot of people do experience purging, I've heard. I think I did, but with me, I didn't really see any more. I just saw it kind of stay a little bit longer, and then all of a sudden it just started going away really fast. Like, it's, for some people it's just different. Every case is different. That's pretty much all I can tell you. That just talk to your dermatologist. That's the biggest thing. Every month they'll have you fill out this form, this online survey thing, and it's pretty much to make sure that you don't get pregnant. It makes sure you are informed. At least with my pharmacy, it makes sure that you are informed in what you are doing and what you are taking and what precautions to take, like not getting pregnant, not having sex, or having birth control. You have to have at least 2 forms of birth control or abstinence. So I did take birth control for just like the first month, I think, or the second month. My doctor or my dermatologist recommended it, and he said that sometimes it can help aid with the results. To me, I don't know, I'm not sure, because I don't have really a control to look at, so I can't see if it really helped with Accutane or not. I don't know, I just decided to try it, but then I went off it because it was like kind of pointless, because I really couldn't see any difference. So they make you fill out that. Your baby can come out with a deformed head or blindness, so it's a big deal, and they do take a lot of steps to prevent that from happening, but it's all up to you. So Accutane is in your system for 30 days from the last pill you take. So you could take a pill one day and the effects will last 30 days, but then you take it the next day and then 30 days. So it kind of, pretty much, it won't be out of your system until 30 days after the last pill you take. So they tell you to refrain from having sex or trying to get pregnant until 30 days after you stopped Accutane. I would wait longer because, I don't know, just an extra safety thing. I did experience lower back pain every time I got up, every time I laid down, every time I sat down, and it did hurt a lot, but I mean, it was tolerable, I think, but it was just kind of annoying, you know. The whole thing is just tedious and annoying, and you have to get through it, but when you see results, you get really excited. All these side effects were gone like within the month that I stopped taking Accutane. Not everyone will experience these. I'm just saying some of the ones that I experienced and that you could experience as well. Depressive thoughts, not necessarily depression, and that's a big misconception too. Accutane or isotretinoin does not cause depression, and all the tests that they've done for it. A lot of people claim that it does, but it causes depressive thoughts. And a lot of things that I did to get through this was to kind of remind myself that this was all Accutane, and that after this, you know, I'll get through it. And it was kind of just, I felt sad for no reason, and I had like thoughts, like just bad thoughts. And if you do have suicidal thoughts, I would recommend talking to a therapist or a doctor and telling your dermatologist these side effects every month or once you start experiencing them, because it is a big deal, and they can take you off Accutane. Another thing is that you can always stop. You can always talk to your dermatologist and stop. Whenever you feel like the side effects are too much, then you can always stop. You're not trapped. That's what I did to get through it. I reminded myself that, oh, it's just Accutane, you know? And then I felt much better. So will your acne come back after Accutane? So only 20% of people that take Accutane experience the acne coming back after they've stopped. And that does sound a little bit scary, but if it does come back, you can always go back to your dermatologist and he can prescribe a less intense topical cream that just kind of keeps it down. He prescribed that to me. It's like a really, really low percentage of isotretinoin. I didn't have to ingest anything, and I still use it sometimes just to, you know, like once in a while, just to keep everything down. Either he can do that, or they can put you on a higher dosage for Accutane. So yeah, your dosage can vary. It is just that's one of the reasons why you have monthly checkups, to see how everything's going and what steps need to be done. Women with hereditary acne are more likely to experience acne coming back, and also acne is more likely in women as well. A lot of people ask me about the price of Accutane, and I'm not sure if it ranges from different, obviously on the dosage, or different brands or pharmacies. I'm not really knowledgeable about that, but for me it was $999, but my insurance covered $900. So I only, to my knowledge, ended up paying $9 for it, which is incredible. The thing with Accutane now is that it's way cheaper than it was before. Around the 50s, I believe. It was $200 monthly for 40 milligrams, and now it's only about $75 monthly if you take 1 pill per day, and then $150 if you take 2 pills per day. I would talk to your dermatologist to talk about the price, because a lot of these things are case-based and I can't really give you all the answers for that. Although it was only $9 for me, you still have to pay for monthly checkups. For me, it was $25 a month. Here's the biggest misconception that I've heard and that I've seen everywhere, and it's like almost spammed in my comments, that it honestly got me really scared. And a lot of people just like to flood you with fear, and I think it's just not fair. So I decided to do my research, and I decided to ask my dermatologist and do some research of my own. And this misconception is that Accutane makes you infertile. A lot of people like to use false correlation, or they are not sure what exactly correlates with what. For example, I had a comment that said that I think her husband took Accutane or something, and now when they're married and stuff, they can't have kids. That doesn't necessarily mean that it was from Accutane. Pretty sure that this wouldn't be on the market if it did cause something as big as infertility. And considering all the precautions they take for birth defects and not getting you pregnant, and all the, it's like they really care for you, and I personally don't believe that they would be selling you this, or at least giving it to you without telling you about the risk of infertility. Of course, this is everyone's choice if they want to take Accutane, if they don't want to take it, and it also depends on your tolerability. Do you think you can handle the pain? And it's not that bad, for me at least. It was really uncomfortable, and I'm not gonna lie, and it just depends on what you want to take on, and it's really up to you and what's safe for you. And just remember that you can always stop. What I would recommend you is to just do your own research and do what you're comfortable with. Another thing is, I know it's really hard and like dealing with all the comments that people give you about your acne and stuff, but this is gonna sound so cheesy, and I went through this too, and you know, people that just barely saw me in the streets and like didn't even, you know, just the first time they ever talked to me, they would recommend something for my acne, and just something so ignorant that I know they're trying to help sometimes, but I know it can bring you down and affect you. And people that suggest little things like, oh, drink water, even though you obviously, you know, you've heard all that, you've tried everything, and that's why you're on Accutane, that's why you're trying something a little bit more intense. That really can affect a person, and I know the toll that it can have on you. The thing that I can recommend you and suggest to you is to please just keep a positive mindset, even though it's so hard. Looking back, you'll see that it's such a waste of time to kind of focus on your acne and not want to go out because of it. And I know it's a genuine concern for some people, and I just don't waste your time worrying about that or what other people think. If they see you on the streets and they notice your acne, they'll forget it in the next 5 seconds. Acne is normal. Almost everyone goes through it. And I know you've heard that probably millions of times before, but the mindset that you keep while going through all of that and the confidence that you express really, really makes a difference. So I would recommend that for you. And if you have any questions, please leave them down below. I need to show you guys some of the products that I used. A lot of you guys have been asking me that too. It really wasn't anything very intense at all. It was more gentle, like Cetaphil cleanser. It's just a gentle face cleanser. It doesn't even really have any like soapiness to it. This is the cleanser that I started using at first. It's just a gentle skin cleanser, and it's mild, non-irritating formula. Another thing that I switched to though was this Glossier Milky Jelly Cleanser, and really anything will work. I'm not like sponsored or anything, because come on, like, that's crazy. It doesn't leave your skin dry or strips your skin of a lot of things. It's really moisturizing. Another thing is the Glossier Moisturizer. It has just pretty much anything with hyaluronic acid I would recommend. It really leaves your skin moisturized without that oily, greasy feeling. It just feels like a splash of water to your face. And it really works for me. But really anything gentle will work. The thing that they prescribed to me was this Tretinoin Cream, just for after Accutane. And then, like I said, I use it sometimes. And the big thing is Aquaphor for your lips or any dry patches that you may have. I got the big tub, the big boy. I wouldn't recommend the little teeny tiny tubes. This thing lasts a really long time, and I would recommend this one because I do think they're different consistencies. I don't really like the tube ones that kind of look like chapstick. Try to buy some lip cream. Some people use nipple cream because it's supposed to like help like for breastfeeding moms, to help like when they're chapped and stuff. Chapstick sometimes just tends to like seal your skin and stuff, so it doesn't dry anymore, but other creams kind of heal it a little bit better, so I would recommend opting for creams instead. Another huge thing is sunscreen. I know you guys have heard this a lot, but it's so important, so important. I would try to get the highest SPF you can find. I have one by Neutrogena that's I think 110 SPF. It's really light, but it still has that kind of white cast to it. But I'm out of it now, but I did find the Glossier. I'm not sponsored, I swear, I just love them so much, and I don't know why I'm not sponsored yet, but come on guys. But the Glossier sunscreen works so well. It's literally like transparent, and it goes on so thin and so smooth. It's only 35 SPF. You just have to, you know, keep reapplying it and stuff, but it smells so good. It doesn't smell like sunscreen. It smells like lemons, and I don't even know. It's just so good. I really like it, and I had a really good experience with it. And it's not oily either. It's pretty much like a light moisturizer, but it protects your skin. Eye drops if your eyes get dry. Something that I didn't really expect my dermatologist to say was that you need a lot of exercise when you're on Accutane. Not a crazy amount, just kind of stay up, stay active a little bit so that it doesn't have as big as an effect on you. I'm not sure why, I don't really remember. I'm pretty sure it can alleviate some joint pain and back pain. And also a lot of water, because as I said, it kind of takes all the oil out, and I don't know, when I just was really thirsty during Accutane, and water's so good. I love water so much. Anyone can take it. Go to consultation. Boys and girls can take it. I have had that question. Can you vape on Accutane? Yes, but I looked it up. It should be fine, I guess. Yeah, stay safe. I hope I covered everything, and thank you guys for all the support that you guys have given me on my other video, and all the super nice comments you guys give me. It really makes my day, and I appreciate you all so much. So thank you so much. I really appreciate it. See ya.